All right. I'm so excited to have Dr. Reshma Salvi on today. Thank you for joining us.
Hello, hello. We made it here finally.
It's been a test of our patience today, but
I know.
so you are so cool. So you trained as a traditional physical therapist, but you
Yeah.
kind of created your own path. And what has led you to do pelvic floor therapy?
Yeah. So I started as a physical therapist in 2010 and mainly started working as orthopedic PT. And then over a period of time, I worked with a lot of people with chronic pain, low back pain, hip pain. I worked with a lot of trauma patients, car accidents, and everybody was reporting few symptoms which I was not able to help with. For example, people, some of these patients would report, oh, I do have a little bit of leakage or pain down there, or they'll say, you know what, my stomach is messed up, I have constipation. Some of the patients I saw, they were also after the post-cancer rehab or postpartum moms. They were not referred for pelvic PT, but just general physical therapy. And everybody saw a little bit of improvement, but there were some symptoms which I didn't know what else to do. So, I always was interested in women's health and pelvic floor because it's just like a 1 hour lecture in PT school. So I didn't know how to really go about it. And then life just got busy. But around COVID time, a friend of mine kind of introduced me to this Pelvic Health Academy through American Physical Therapy Association. And yeah, that's how I started. I thought I need to add something to these, you know, traditional physical therapy treatments, like we are doing exercises, stretches, modalities, but something is missing.
Mhm.
And yeah, I think my way of treating and looking at each client just changed after that.
Beautiful. I mean, that's kudos to you for exploring and digging.
Yes. Yeah, so American Physical Therapy Association has their Pelvic Health Academy, and these are foundational trainings, which is all theory plus hands-on labs, where
Mhm.
we literally learn on each other. And just after the first class, I learned so much more that
Mhm.
all these patients' cases started popping in my head. Oh, this was missing here. I should do this, do this. So yeah, it's another world.
Eye-opening is what it sounds like.
Yes,
So
surely.
we're talking about pelvic floor. What does it exactly do?
Yeah, my favorite topic.
Yeah.
So I always have my pelvis model whenever I do any podcast or any videos. So this is a female pelvis. So I'm just gonna go through like a basic anatomy. So pelvic floor, there are multiple layers. So this is how it looks from the front in female. So at the top is the urethra, the pee hole, and then there is vaginal opening, and then in the back there is anal opening. So all you see between this bony part, all this red muscles, these are superficial pelvic floor muscles.
Mhm.
And these are responsible for sexual arousal, orgasm. So that superficial layer is mainly, also urination. Then there is a deeper layer, pelvic floor. So this, I'm going to hold it like that so you can see. So it starts from inside of the pubic bone. So it starts from inside of the pubic bone and it goes all the way at the bottom and attaches to the tailbone. So this is the deeper part of the pelvic floor. So this is like a sling,
Mhm.
but it's not one muscle. There
Mhm.
are multiple muscles. They start from different parts of the pelvis and then they attach as a group, to different parts of the tailbone.
Mhm.
So it's basically like a glass of wine. The that when we palpate through vagina, it feels like okay. When you don't know, it feels like okay, what's in there? But then it's like a bowl
Mhm.
where all these muscles are situated.
Mhm.
And They literally hold the pelvic organs. So right behind the pubic bone is the bladder. Right behind the bladder is uterus in females, and then the rectum.
Yeah.
So all these organs are directly supported by pelvic floor, and that's why these group of muscles, ligament, all the soft tissues in that area are so important.
Hmm. So what symptoms would someone have if they had compromise in the pelvic floor?
Okay, yeah, that's a good question, and this is the very important part because that's what people don't know how to really identify what's happening and how to seek help.
Hmm.
So there is usually never one thing. There is never one symptom. There is always combination of multiple symptoms.
Hmm.
Um, Very commonly we know, which is the bladder leaks. That could be because of the weak pelvic floor muscles, but most commonly what I see clinically is tightness in pelvic floor.
Hmm.
So tightness in pelvic floor is something people are talking about it more now, but tightness and weakness both can exist at the same time.
Hmm.
So bladder leaks is one of the common symptoms which a lot of people know. But other than that, when the pelvic floor is tight, when we are supposed to empty bladder or have bowel movement, pelvic floor is supposed to relax and let go naturally.
Hmm.
That mechanism gets off. It's not able to voluntarily relax. So that's when I see symptoms like chronic constipation. People are drinking lots of water, they have to take supplements and different powders to be able to have bowel movement. So constipation is one of the common symptoms, but it's hard to connect that it's related to pelvic floor. So that's why I'm mentioning it like earlier. In females, a lot of young females I'm noticing now, difficulty or pain with tampon insertion.
Mm.
Women are terrified going to OB because they cannot handle speculum exam. Um, that is very, very, I'm seeing it very, very commonly.
Hmm.
Also, a lot of times, if the pelvic floor is tight, a lot of women feel pain with IUD insertion.
Hmm.
Also, sexual pain or pain with penetrative intercourse.
Hmm.
So, those are all signs of tight pelvic floor. And then, most of the time, it's accompanied with pain.
Hmm.
Sometimes women will report burning pain or shooting pain or just low back pain or tailbone pain getting worse
Hmm.
after certain activities or insertion.
Hmm.
So these are the common symptoms I see and a lot more. Low back pain, tailbone pain, or hip pain. If it is going on for a very long time, there is a very close association with pelvic floor involvement. So if somebody has done chiropractic treatment, have done traditional physical therapy, um, have done injections, but the only thing which is not being assessed is the pelvic floor, and there is a lot of research between low back pain and urinary incontinence or chronic pelvic pain. It's all complex and it's kind of, you know, interconnected and interrelated. So pain, weakness, tightness, all three things can happen at the same time, but it's different for everybody.
Hmm. I imagine there's a lot of variables also in terms of the root cause, like you mentioned, trauma, um, accidents, but like, you know, what about posture, stress, breathing? Like, I'm sure all of that also has an impact on how the pelvic.
Yeah, yeah. So posture, as you know, gets affected by so many things. Uh, People are doing more computer jobs or sitting jobs. With prolonged sitting, there is constant pressure on your discs, but constant pressure on your pelvic floor, tailbone. Um, that definitely affects pelvic floor. During pregnancy and postpartum, there is huge change in, the pelvis, hip, low back anatomy. So that definitely affects pelvic floor. So every pregnant patient or pregnant woman and postpartum, they must see pelvic floor therapists.
Hmm.
Um, because a lot of times the symptoms don't come right away, they come after 4 or 5 years. So
But that's a
that,
big point people may not realize. Timeline.
yeah, yeah, and all that mainly happens because of all the postural changes and anatomical changes.
Hmm.
Stress, which is something we really cannot avoid.
Hmm.
Everybody has stress. And when you're stressed, we either hold our tension in the jaw, neck, and then pelvic floor.
Hmm.
Um, but tension in the pelvic floor, it's not clinically seen, very easily. Uh, and that's why it's tricky and complex.
Hmm.
But I typically notice something happens, this person is doing really well, and then something happens in personal life or work, and then I can notice change in their pelvic floor. There is increased tension, um, there is more sensitivity. So definitely posture, stress is a big part. And breathing, because of stress and our posture and our lifestyle, we all pretty much breathe super shallow. I mean, including me. Now I know so much, so I try to take breaks and work on it. But our rib cage is supposed to expand 360 degrees. But mostly it's pretty shallow, so we just see the front rib cage movement. And a lot of times the side, like a bucket handle movement, and the back of the rib cage gets neglected.
Hmm.
And that's also influenced by pregnancy, postpartum, the way we stand, all those things.
Hmm.
So breathing is really the basic foundation when, I start working as a pelvic PT. Um, I like to kind of I'll show this. So imagine there is a pop can. It's not a can, but let's imagine. So the top part, the roof is the breathing diaphragm. The bottom foundation is pelvic floor. The front is your front abdominal wall, and in the back is your spinal muscles. So this is what we call as core canister. And any changes in all four walls can produce symptoms. So a lot of times I see there are reasons outside the pelvis or pelvic floor which are affecting the way we manage pressure in intra-abdominal area, and that's what leads to some of these symptoms.
Hmm.
And this assessment typically does get missed in traditional PT practices because it's just so busy.
Yeah, and I mean, to put it into the whole body picture, like if the organs in, your abdominal area are not functioning well, that's where your gut is, that's where most of your immune system is. So inflammation and most of where your lymphatics are. So your ability to clear toxins, the way your immune system functions, it all depends on breathing and how your whole system is functioning together, which I
Yeah,
realize.
exactly. So when I see chronic pelvic pain patients, they always have gut component.
Mhm.
Either they are going in severe constipation or diarrhea, constipation. A lot of male clients actually get misdiagnosed as chronic prostatitis,
Mhm.
and they are prescribed 2, 3 rounds of antibiotics, which affects gut health,
Right.
and the pain doesn't go away. So that is why pelvic floor therapy is different, that I'm looking at the whole picture. I'm
Right.
talking about these gut symptoms. I'm talking about their bladder health. I'm asking them about their diet. Uh, yeah, so it is not as simple as shoulder or knee pain, which the trajectory of the progress.
Right, right. And it affects, like, if you're breathing shallow, that's going to tell your nervous system you're in fight or flight. If you're in fight or flight, you're never going to repair. So it's like a big picture kind of
Yeah,
cycle, essentially.
yeah, and you obviously are doing yoga nidra and everything, which is positively influencing, you know, vagal tone. And as a pelvic PT, I do use some of the, vagal nerve stimulation techniques too. Because with this chronic pain or all these symptoms, their nervous system is upregulated.
Mm-hmm.
And if we don't really work on that, then no matter how much manual therapy I do or how many exercises I teach them. So a lot of the session also goes in education about these things.
That's great. And then, so what are some, like, what have been some of the most rewarding cases you've seen?
Yeah, I mean, a lot of them, and it feels great. At the end of the day, I feel like, okay, I'm making some really significant difference in these people's lives. Uh, Important thing which I'll say is their confidence and mental health. Uh, Number one, again, is I'm someone who is validating their pain or unanswered questions. So that is what makes me feel like different, and it's so much rewarding that when I tell them that, yeah, whatever you're experiencing makes sense because of this A, B, C reasons. And that gives them the confidence that, okay, I'm not going crazy. There is something really wrong and we can fix it. So that shift in their mindset, that I feel is like really rewarding, that they get that confidence after the initial session and then ongoing session that, okay, this is going to change my life. And because there is no awareness and they have no idea, even with basic education, they feel that huge change.
Mhm.
And it's just overall quality of life. I mean, I'm working on components, which is like your basic being.
Yeah, I know, right.
So when somebody says, "Oh, I was able to use the bathroom and it wasn't painful," or I'm having bowel movement every day. It's like big thing. It is very rewarding. It sounds funny, but it is. And then of course, uh, I see a lot of patients with chronic pain,
Mhm.
and there is just they're trying to look for answers for approximately more than 5 years sometimes. I have somebody who is in pain
Yeah,
almost 20 years. So when everything starts making sense for them, it does feel really rewarding. It feels like I'm actually doing something to change their everyday life. That's
yeah,
what is rewarding.
it's good. Thank you for doing that work because I know a lot of patients can feel very lost in the system and defeated. And so it's really great that they have someone like you to work with. And I know you're not working in the traditional system, so you are cash-based practice. Is that right? Um,
Yeah.
but where can people find you and learn more about you?
Yeah, so I have my Google business profile, Core and Beyond Physical Therapy, my website, www.coreandbeyond.com. That's the best place to reach out. Uh, you can put in show notes my phone
I'm ready
number,
to
my
go.
email address, but the best way to reach me is through my website. As soon as you go on my website, there is Schedule Now tab. And once anybody submits their information, I personally call them. So I'm a solo practitioner. I don't have admin person yet, so I'm the one they talk to. And it's actually very helpful that they feel actually more open and comfortable than explaining something to some unknown person.
Of course. And I think one of the really beautiful things that you offer that I haven't seen anywhere else is that you do home visits. Like that's how passionate you feel about this because many women, especially postpartum or, you were saying they get busy with caring for kids that 4 or 5 years down the line, the symptoms are coming, but they're so busy that they don't even I mean, they can't literally take time for
Yeah,
themselves to get better.
there there is a lot on their plate, and this was actually part of the research which we had to do during this certification. And there is a data that child care or family issues are number one reasons why women don't seek help, because who is going to look after kids? Or if they have very young kids, they have kids appointments, there is so much going on. And that's why their health starts declining, and they're still doing everything, but the things I mentioned, like the person looks fine from outside, but there is a lot going on. So
Yeah.
I do offer home visits within like limited distance, obviously, but that's an option. My clinic hours are very flexible. I try to be as flexible as possible, so I do offer late evening appointments. A lot of my patients come after work. Yeah, and I purposely chose to be cash based or out of network because I worked in that insurance based setting. I worked in outpatient for 10 years. And
It's limiting.
I had it's limiting because, like I mentioned, patients were progressing and they were feeling better symptomatically, but they were not recovering completely. So in couple months they'll come back. And
Right.
then insurance really decides how many visits you're gonna get. And then the reimbursement is so low that to survive, you have to see multiple patients. So I do really, appreciate people who are working in network settings. But the care, the quality of care is just a lot better. It's more focused, more individualized, and I'm working with the clients with whatever they need. So, like I said, my pelvic pain patients have headache, neck pain. So I'm working on that too. I don't need a new script or a new order from doctor. Yeah, so I'm working on whole body, whatever you need during that visit, and that really helps.
That's great because usually there's more than one thing going on. So,
There is always more than one thing going on, and I mean, you become part of their whole journey. Like you know everything about them
Mhm.
once I start working with them. Yeah, I have inquiries like, do you work on hip? Do you work on knee?
do you
All
see
that.
you see males as well?
Yeah, so I do work with male clients too, and male pelvic health or male pelvic rehab has, it's still a little bit behind than women's health because men don't, again, these issues are so sensitive that they don't talk to each other. So, like I said, that's why we lose so much time in between. But I am very comfortable working with men. All my male patients, they are great clients. They listen and implement everything I say. So I really do enjoy working with male clients too.
Well, I will tag everything so people can find you. Thank you for taking the time and
Thank you so much.
yeah, this is really important work that you're doing and people will get better faster.
Yeah, and I just want to mention a lot of times people don't know if this is the right treatment for me. I would recommend email me or reach out, and I usually spend at least 10 minutes understanding what's going on and then only schedule an appointment. So you'll know if this is right treatment for you.
Wonderful. Thank you so much.
Thank you. Well, thank you for taking time for this.
Of course. Yeah, my pleasure.
Yeah. And just last thing I did want to mention, I accept HSA and FSA.
Oh,
A lot
that's
of my clients use that. And I also offer providing super bill. So if they want to submit it to their insurance, yeah,
that's great. Yeah, really good to know.
yeah.
Thank you.
Thank you. Have a good night. It was nice talking to you. I enjoyed it.
Me too. Thank you.
Okay. Bye.